Hello, welcome to the virtual Pulp Dent booth. This is your virtual commentator, Dr. Robert Lowe. I serve as a clinical affairs consultant for Pulp Dent Corporation and have worked with them for many years. I am a practicing dentist in Charlotte, North Carolina, and am also on faculty at Medical University of South Carolina School of Dental Medicine. And it's my privilege to be able to share with you some insights into some of these innovative products that Pulp Dent has to share with the dental community. In this video demonstration, we will cover the following topics. What is bioactivity? The science beyond the marketing buzz. Why bioactive and dynamic products are important to you and your patients. What current research shows about the effectiveness of bioactive and dynamic restorative materials? How bioactivity relates to ion release, recharge, and appetite formation. A review of Pulp Dent's ACTIVA bioactive product line. And an introduction to the latest in Pulp Dent's ACTIVA line, a dynamic composite material called ACTIVA Presto. So what is bioactivity? The concept of bioactive materials was first introduced in 1969 and later defined as follows. A bioactive material is one that elicits a specific biologic response at the interface of the material, which then results in the formation of a bond between the tissues and the material. In 1996, Larry Hench expanded on this concept. A bioactive material creates an environment compatible with osteogenesis or bone growth, and this mineralization process forms a natural bond between the living tissues and the non-living synthetic restorative materials. So think about this for a second. We've been talking about bioactivity in very relative terms for years in the field of dentistry. Most dental materials are inert. They don't elicit any type of response when placed in the oral cavity. Now, we have materials that, as we'll discuss, will make quite a difference in the availability of certain ions to help nourish the teeth and help preserve the natural dentition throughout life. So now we're going to introduce some material called ACTIVA bioactive restorative material, one of the first bioactive materials in the long line of Pulp Dent bioactive materials and other dynamic restorative materials now available and for use in our dental offices. I've been speaking about this product for quite a while. I've been using it for several years, and to me, when a product like this comes out, it's a real game changer as far as restorative materials, because for as long as I can remember, I've been practicing dentist since 1982. Restorative materials are inert materials that actually serve no function but to fill a void, fill a hole, fill the cavity. They don't provide any nutritive function to the tooth whatsoever. And we're dealing with a couple of things today that I always ask my patients. Number one, do you want to save your money or save your teeth? Because those two things don't always go together. The other question is, you want to keep your teeth for the rest of your life. Now, most patients will say yes. And if the average person is living well into their 80s, some into their 90s, the chance of them doing it with their natural dentition based on the old way of doing things obviously is not that good. I mean, my grandmother lost all of her teeth in her 30s and wore dentures for the most of her life. Now, granted, we've made a lot of strides since then as far as restorative, but this is the next leap in that realm as far as having materials at our disposal that actually help provide the nutritive functions to the tooth of calcium and phosphate ions, which are the building blocks of appetite. Now, ACTIVA, I've described for many years as a battery or a storehouse for ions, fluoride, calcium, and phosphate. And the tooth undergoes many different changes in demineralization and remineralization through the course of a day, let alone a lifetime. Changes in diet, changes in the quality of the saliva, how much biofilm is present, how much plaque and calculus is present. All of these things affect the ability of the tooth to withstand the acid pH and the byproducts of bacterial metabolism. Once teeth start to demineralize and bacteria infiltrate, that's when we have decay and tooth loss. So obviously, if we can restore teeth with materials that provide these nutritive functions, we stand a much better chance of having a tooth last for a longer period of time. So ACTIVA provides calcium and phosphate and fluoride to a demineralized tooth. And then obviously the amount of calcium, phosphate, and fluoride diminishes in the restorative material, but it's then recharged through food, toothpaste, water, saliva, dental tubular fluid. So there's this constant ion exchange between acid groups at the ionic resin and the tooth structure interface. These occur at a molecular level. This slide shows apatite formation, calcium phosphate apatite, the formation of that on the surface of ACTIVA after 21 days in a moisture environment, saline. So imagine again, this is a restoration in your mouth. Are the restorations in your mouths able to precipitate apatite on the surface, able to help seal restorative gaps by the precipitation of apatite? Well, the answer to that is no, unless you're using a material such as ACTIVA Bioactive for your own dentistry. Now, these slides are interesting because it's a comparison between today's restorative materials and ACTIVA as far as compressive strength and diametral tensile strength. ACTIVA really doesn't know whether it's a composite, a resin, an ionic resin, if it's a part calcium, is it like glass ionomer or resin modified ionomer? Well, it has some of the characteristics of both of these materials. As you can see, when comparing compressive strength with composite, in this graph, the composite is Filtech. The compressive strength of ACTIVA is very close to the compressive strength of composite. You can see that glass ionomer is not quite that much. In fact, glass ionomer is not designed to take compressive strengths or compressive load. It's used as a dentin replacement, which needs a composite material above it or on the surface to withstand the forces of occlusion. Same with tensile strength. ACTIVA and Filtech both have high tensile strength, which means they're similar in this capacity. Glass ionomers have very little tensile strength. Now, when looking at wear, the wear rates of these materials, glass ionomers are going to wear tremendously high because they're not designed, again, to take forces of occlusion or occlusal wear. ACTIVA wears more like a traditional composite. So you've got ions, nutritive ions, calcium, phosphate, and fluoride, ion release and recharge, but yet you have a material that has wear rates, compressive strength, and diametral tensile strength similar to a composite. This is a case of mine, caries control patient. For years, glass ionomer was the material of choice for caries control because of fluoride release. But today we have a material that not only has fluoride release, but also the building blocks of apatite, calcium, and phosphate to help some of this demineralized dentin remineralize to healthy dentin. So this is an example of a caries control patient being taken care of with ACTIVA Bioactive Restorative. Now, these may be young patients, they may be old patients, in the geriatric world, with root caries and saliva depletion. Caries sometimes becomes very difficult to manage, and these types of patients work real well with a bioactive restorative material. Now, I get this question from a lot of dentists. about how can this bioactivity work through a bonding agent? Because we're brought up with the fact that these bonding agents seal teeth, seal dentin, which they do. But on a molecular level, bonding agents are like a semi-permeable membrane. Do the ions release from ACTIVA? Do they pass through a bonding agent? Well, there is evidence that this happens on multiple researchers that have looked at this. ACTIVA helps prevent the breakdown of the bonding layer. How does it do this? By inhibiting the release of MMPs. When the bonding agent is applied using a two-step etch and rinse. This is from Salvatore Soro. Degradation of the bonding layer is the leading cause of composite failure, where it certainly is one of the main causes of composite restoration failure, or of crown failure when composite resin cements are used to cement crowns. Degradation of the bonding layer can cause micro leakage and breakdown of the tooth surface. Studies do indicate lower concentrations of MMPs with ACTIVA, as I previously mentioned. Now, ions released from ACTIVA passing through a bonding agent. Again, this is another study that was done at Tufts University School of Medicine. Fluoride release of bioactive restoratives with bonding agents. Study demonstrated that the fluoride ions from the restorative material were able to penetrate through the adhesive bonding agents tested. This is a study from Soro and Pashley showing that ions released not only pass through the bonding agent, but they also help prevent the degradation of the dentin bond by inhibiting the release of MMPs. So we can see that there's a definite problem with that in regards to etch and rinse with traditional composites versus here we see ACTIVA, bioactive, and on the bottom Presto, which we're going to be talking about in a moment. Now, talking about ACTIVA bioactive, one of the other partners in the line is base liner, as you see here on the left. ACTIVA bioactive base liner is a dual cure, contains glass ionomer, injectable, and has low shrinkage stress. Has many of the attributes of ACTIVA bioactive as far as the ion release and recharge. Now, one of the main things to remember with these products is that they're moisture friendly for easier technique control. This is critical because composites work only when isolation is perfect. I mean, they work optimally. And you know, as a clinician, I know as a clinician, there are many times where it's very difficult using any technique to maintain pure isolation. And in those types of areas, it certainly would be nice, wouldn't it, to have a material that you could use that has the attributes of ACTIVA bioactive and has a lot of the physical attributes of composite resin, but is also moisture friendly. Another important point is the rubberized resin in ACTIVA absorbs shock and stress, so it's not as brittle as a conventional composite. So these are important points to think about when you're choosing your materials. I hear people all the time in lecture. They'll ask me, well, I've been using Vitribond and I don't have any sensitivity and it works good for me and this, that, and the other. Well, there are many materials that worked good as far as our standards, 30 years ago, 20 years ago. But as I tell, the analogy, I said, horse and buggy was a good way to get around town, but we actually have automobiles, and pretty soon these automobiles will fly. So the technologies are there to give better restorative services to your patients, period, regardless of it works for me and I've used it for years and this, that, or the other. What is this about? Is it about us as dentists, or is it about treating our patients the best we can? I think you know the answer to that. Now, Limelight has been a product in the pulp dent line for years, and Limelight has been enhanced to contain bioavailable calcium and phosphate components, and it has similar chemistry where the rubberized resin component is concerned to ACTIVA bioactive base liner. So while one is a dual cure, Limelight Enhanced is light cure only. But many have, these materials have many similar attributes, as you can see here. Now, moving on in the ACTIVA line, we come to ACTIVA Bioactive Cement. You know, this is a self-etching resin cement used for cementing crown and bridge. Now, some of the attributes of ACTIVA Bioactive Cement: multi-purpose. In other words, you can use ACTIVA Bioactive Cement for a lot of different substrates. It bonds well to zirconia, high-strength ceramic, metal. It also has a component in the shock-absorbing area because of the rubberized urethane to help reduce stress and occlusal forces on the cement. It resists chipping and crumbling and washout. Easy cleanup, low film thickness. And because it's a dual barrel syringe, it eliminates capsules, activation, and trituration. ACTIVA is different, not only in the restorative area, but in the cement category as well. But stimulating mineral apatite formation that penetrates and fills micro gaps, knits together the restoration in the tooth, guards against recurrent decay, seals margins against micro leakage and staining and failure. It's nature's way. I ask again, how many of you in the audience, how many of you dentists have crowns in your own mouth? You know that there's no such thing as a closed margin. None of us have closed margins. It's only a question of how open they are. 30 to 50 microns is considered acceptable. We can't feel a 30 micron margin with the Sharp Explorer, but that doesn't mean that there isn't a gap, because bacteria are 1 micron in diameter. So 29 of those little bacterium can crawl right under a margin that has cement washed out or has a void or what have you, and gain access to the internal aspect of the restoration in the tooth. So if you have a crown in your mouth, wouldn't you rather have it cemented with the material that actively stimulates mineral apatite crystal formation on the surface to help fill micro gaps and prevent against recurrent decay and leakage? I know I would. This SEM shows a cross-section of dentin and ACTIVA bioactive cement. And you can see on the photomicrograph on the right, that gap is actually was produced when the specimen was fractured, but you can see apatite layer formation on the surface of the dentin and the tubules being filled with mineral tags. This is from the formation or from the calcium and phosphate that is available from ACTIVA to help form apatite at this interface. So this is a nice graphic illustration to show what happens with a crown margin over time, where biofilm is present and acid metabolism and breakdown can cause demineralization of tooth structure, and as the passive cement may dissolve and degrade through time, these margins or areas then become suspect and then in early breakdown as far as their ability to maintain a marginal seal. Bacteria can then get underneath and recurrent decay can happen. Now let's change gears a little bit and let's talk about the new composite material, an ionic resin called ACTIVA Presto. After years of success with ACTIVA Restorative, PulpDent has innovated the first light-cured composite designed to mimic the properties of natural teeth. ACTIVA Presto is a mineral-enriched aesthetic composite. ACTIVA Presto is a dynamic, moisture-friendly material that responds to pH changes in the oral environment. ACTIVA Presto releases, recharges calcium, phosphate, and fluoride. It's tough, durable, rubberized resin, resistant to wear, fracture, and chipping. It's a stackable, shapeable, low flow, flowable material with no pullback. Doesn't slump. You can make shapes with this. Contains no bis-GMA, no bisphenol A, or no BPA derivatives, and is really useful for all restorative procedures and in load-bearing applications. The two fundamental elements of ACTIVA Presto that mimic nature: number one, the moisture-friendly, mineral-enriched ionic resin first introduced in pulp, dent, and brace products. And then the patented rubberized resin technology that was first introduced in pulp, dent's Tough Temp Plus provisional crown and bridge material. The tooth is the standard. And if you look at these different categories: aesthetics, moisture-friendly, high strength, release and recharge of calcium, shock absorbency. If you look at natural tooth structure is positive in all of those categories, as is ACTIVA Presto. But when you look at traditional composite resins, yes, they're aesthetic, but no, they're not moisture friendly. They have high strength capacity, but they do not release or recharge calcium and phosphate, and they don't have shock absorbency. They're very brittle. These graphs represent calcium, fluoride, and phosphate release and recharge from various materials. Here you can see ACTIVA Presto, ACTIVA Bioactive, Beautifil Flow Plus, and Filtech Supreme. Now, Beautifil Flow Plus is a composite resin that does show some ion release. Other than ACTIVA, I don't know of any other composite on the market, and Filtech Supreme has a high market share, but you can see it pretty much flatlines on everything here. But when you look at that in comparison to those two, to ACTIVA Bioactive and ACTIVA Presto, you can see quite a bit of difference in multiple charges, release and recharge, as these materials continue to help remineralize and demineralize tooth structure. Mechanical properties, we've mentioned some of the properties in regard to ACTIVA Bioactive Restorative, but ACTIVA Presto, and compared with with several of the other composites out there, has a high deflection at break. In other words, because of the rubberized urethane resin component, it's not as brittle. Flexural stress is no statistical difference, and volume wear, you can see the amount of wear is certainly a lot less, as we mentioned, than glass ionomer. So some of my cases from my office, again, using quantitative laser fluorescence and fissurotomy for early diagnosis. You can see these are definitely not GV black extension for prevention, but they're prevention of extension, just removing the decay, and then using ACTIVA Presto as the restorative material into those small preparation fissures. Once light cured, making minor adjustments with a carbide rotary composite finishing burr and ASAP polishers to really create restorations that are barely visible, let alone taking away healthy tooth structure, as we were taught in school in our extension for prevention cavity preparations. Here's one of my clinical cases I showed with cervical repair made with ACTIVA Presto. I was involved with some of the testing early on, and recommended that we have some darker cervical shades for our older patients with gingival recession. And the question is, can you find the restoration on the distal of 26 or on the mesial of 27? And I think it's pretty hard to actually detect that those are restored surfaces. This is a class 2, courtesy of Dr. Robert Ho, showing a class 2 replaced with ACTIVA Presto. Again, I'm sure that Dr. Ho used a sectional matrix in this case to maintain the proper contour of the proximal surface and create a consistent contact. From Dr. Denali, severe caries restored with ACTIVA Presto, shade A1 and A2, beautiful case. So here, this slide shows some of the overlap and some of the unique characteristics of both of these materials. I think it's important to understand that both materials I feel are needed in the armamentarium. ACTIVA Bioactive Restorative is a dual cure, contains some glass ionomer material, is injectable, flowable. It can use a bulk fill because it's dual cure. And while it's aesthetic, you don't have as many shade options with ACTIVA Bioactive Restorative as you do a traditional composite. That's where ACTIVA Presto comes in. ACTIVA Presto is a light cured version, contains modified calcium phosphate, stackable, shapeable, low flow, no slump, and 2.5 millimeter increment placement for all cavity preparations. And you have a wide variety of shades for aesthetic concerns. So to me, this is really the new hybrid sandwich technique, where on a larger composite restoration, or a restoration where you would consider a bulk fill composite, a bioactive restorative dentin material such as ACTIVA, and an enamel layer with Presto, where aesthetics is concerned, makes to me the best of both worlds. The magic is in the resin. Moisture-friendly, mineral-enriched ionic resin facilitates the diffusion of calcium, phosphate, and fluoride that integrates with tooth structure. Patented rubberized resin is tough, shock-absorbing, and resists fracture, wear, and chipping. Patented modified calcium phosphate component is soluble in monomers and binds to the calcium in teeth. Urethane-based resins contain no bis-GMA, no bisphenol A, and no BPA derivatives. Positive impact of bioactive materials for you, your staff, and your patients. Take advantage of your most valuable commodity, your chair time. I think most dentists are very conscious of, how many pennies they spend on this composite or that bonding agent or whatever. But think about it. What's your most important commodity? It's your chair time. How much per hour does it cost to operate your dental chair? How much do you need to make to pay yourself, your staff, your rent, your supplies? Anything that can help reduce chair time, reduce possibilities for remake, reduce possibilities for patient complaint, give a better, long-lasting result. It's going to save you chair time. It's going to save you money. When fewer materials are required, there's less possibility for technique sensitivity to affect the clinical outcome. Fewer steps, time savings, product savings. I mentioned less sensitivity, less marginal staining and micro leakage, because the ability of these materials to fill the restorative gap by precipitating apatite leads to long life and less staining and less micro leakage, better seal. Research and clinical studies provide confidence in greater patient acceptance, and bioactive benefits are easily understood by patients. Just talk to them about it. I do every day. They get it. I'm not so worried about, well, what's my insurance going to cover? Insurance pays for something every 5 years. How many times are you going to salt the tooth in the patient's lifetime? The benefits of bioactive materials are not only easily understood by patients, but they will thank you for it. I don't know what else I could tell you other than the fact that it's time to think about what's best for your patients and how materials like this can impact your practice. And believe me, it does impact your practice, because word gets around. Not every dentist is providing this service. So be the first and help promote good dental care, good dental health for your patients for many years to come. Thank you so much for visiting the Pulp Dent virtual booth, and I hope this information has been helpful to you. Other than that, I wish you goodwill and a good meeting, and I implore you to give this material a try. You won't regret it. Thank you so much for your kind attention.